Well, thank you for coming. My name is Debbie Langto from Avera Health Plans. And this month's topic we are going to talk about is how to make time to get active. Time is usually the biggest excuse that people don't take time to get activity in their daily regimen. So I'm going to give you guys some tips that you can use to find time throughout your day to get some activity in. This is, I love this quote here, exercise is medicine. If the benefits of exercise could be put into one pill, it would be the most widely prescribed medicine of all. I want to invent that pill because then I could just retire. But it's true. The cool thing about exercise, it's free, so you're not having to do your co-pays or take out extra flex money for it. So it's free and you can do it anywhere and you can make time to do it. The CDC, or Center for Disease Control, recommends 30 minutes of physical activity 5 to 6 days per week, or overall over the course of 7 days. We have 7 days in a week to get in 150 minutes, and that is moderate intensity. We're also going to talk about the different types of intensity, moderate and vigorous. If you do vigorous intensity, you can cut that down to 75 minutes a week with that. So, but we'll go through the intensity scales with that, but that's the guidelines that are put out there. Why make time for physical activity? We could probably have 20 slides of the benefits. We all know what the benefits are, but we know that exercise burns calories, so you always want to take into account the calories that you put in. You want to try to have those calories go out. You can manage or prevent chronic conditions. So that we know that exercise can help control high blood pressure. It can help reverse those effects of type 2 diabetes, managing healthy lifestyle with that. It helps reduce stress. We've all had stressful events, and maybe we've done some deep breathing exercises, or maybe we've taken a walk, or we hit the gym. We always feel better afterwards. We're not as stressed. It also helps focus with that too. Helps you sleep better. Sleep is important. Try to get at least 7 to 8 hours of sleep a night. And but exercise is going to help maintain that regular sleep pattern, and you're going to have more energy and be more productive with that. So those are just a few of the benefits. You can break it down. So as we talked about, 150 minutes a week, or that kind of breaks out into about 30 minutes, 5 to 6 days a week with that. You can do 2 15-minute sessions or 3 10-minute sessions each day. Combine strength and cardio intervals with that. So just as important as getting the heart rate going through either a walk, cardio, biking, swimming, you want to get strength training involved with that too. That can be any weight-bearing exercise. It can be body weight, or you can use household items. We have touched in other presentations as far as just stuff that you can do around the house or even the office with that. Intervals and intensities. 1 minute of high intensity equals 2 minutes of low intensity. High intensity means that you can't say more than a couple of words. Moderate intensity means you can't say more than 4 words. Intervals alternate high to low to moderate intensity exercises. I basically just call it the talk or can't talk test. So if you're working out and you can sing a song, you're not working hard enough. But if you're working out and you can't get more than, a couple words in, you might want to take your intensity down a little bit. So it's an easy way to monitor your intensity instead of trying to maybe fumble around and find your heart rate and everything if you don't have a heart rate monitor. So those are just a couple of easy ways. I got the next couple of slides just shows kind of how many calories you can burn doing an activity. So this slide here is going to be moderate activity. So that's basically, as I said, that you can say more than 4 words with that. And you can see how the calorie breaks down. So hiking, you can burn 185 calories if you do 30 minutes of that. Or if you do an hour, you do 370 calories. So, really any activity is going to burn calories. We know any movement, you're burning calories. Even sitting here, you're burning calories. So, but you always wanted to, monitor how many calories you take in on a daily basis to know how many calories you should burn on a daily basis too. Each day it's going to be a little bit different based on your activity level. So if you're not as active one day, you want to make sure that your calorie consumption kind of goes along with that. The next slide is going to be how many calories you burn during vigorous activity. So you're bumping your intensity up. So that would be, vigorous would be 75 minutes a week of higher intensity activity. So, and you can see that you're going to obviously burn more calories by the harder you're working. So that would be running, doing some biking over 10 miles an hour, swimming, aerobics, weight training. And you can see this is based on a 154-pound individual with that. So your weight has a factor to do with how many calories you burn too. So those are just some examples. I like to, when I put together a program for anybody or just even myself, I have 4 components in with that. That would be your aerobic or cardio exercise. So that'd be 150 minutes of moderate intensity or 75 minutes of vigorous intensity. Flexibility, this is usually the big one that's forgotten. Incorporate stretching before, afterwards. Even throughout the day, getting up and doing a little bit of stretching with that too. That's going to help you stay mobile. It's also going to reduce the risk of injury. Plus, it's going to help just maintain kind of that functional piece as we get older with that too, the flexibility. Strength training, again, reduces the risk of injury. So the stronger your muscles are, the reduction of injury you're going to have. 8 to 10 reps, 2 to 3 times a week. So I want to try to squeeze that in. Daily leisure activity, try to move throughout the day, not just during planned activity. So especially if you have a sedentary job where you're at a desk a lot of times, try to get up and move at least every hour, taking advantage of maybe those 10-minute windows of opportunity you have to get some of that activity in. Like we talked about, you can break that 30 minutes up either into 2 15-minute or 3 10-minute sessions throughout the day. At home and on the go, you can get some home workout videos. So there's a whole gamut of everything out there, different intensities, different levels with that, ages with it. So if you prefer to work out at home, you can get some instructional videos. That way you don't get bored or not sure how to get started or what to do. Design your own program. So just like we talked about, taking those 4 components and you can develop your own program. Use your own body weight. So you don't have to, if you didn't want to spend the money on a gym membership or don't have access to that, you can do a lot of stuff at home, whether it's wall push-ups or doing some, getting on the floor, doing some push-ups, sit-ups, any of that. Grab some stuff around the house too, water jugs, cans, any of that. So squats and lunges are also another thing too. So you can do a lot of stuff at home. You don't need to spend a lot of money on equipment. At the gym, so if you do have access to a gym, you want to go to a facility, look for classes. That way you kind of keep things, it's not doing the same thing. You get that social piece with it. A lot of people like to work out in the group setting. Use free weights. Some exercises, bicep curls, tricep kickbacks. So you can do a lot of these with the dumbbells or even just resistance bands. Overhead presses, front raises. Keep your heart rate up, so keep moving. You don't want to cool down if you're in the middle of your workout, so keep moving, kind of, don't want to rest in between too much of the weight training. At the office, do squats and lunges, knee raises by your desk. So even if you're on a conference call or maybe doing a long webinar, try to stand up, do a few things at your desk. We have resistance bands around the office here. If you have access to those, get those at your desk if you know you're going to be on a longer call or a conference with that. Walk briskly around the building. So I always encourage, instead of sending an email or a phone call, walk over to the desk, visit with that person. Take advantage of doing some brisk walking around that, or if it's nice outside, try to get outside, get some fresh air, do some brisk walking. Walk to lunch and back. So if you have the capability to do that, do a little bit of walking instead of driving. We always talk about parking a little further away. Breaking down the barriers. Like we said, this is the biggest barrier or excuse. I don't have time to be active. Some tips that I have for an action plan on that one would be, when is the best time to be active? Morning, lunch, or evening? So take a look at your schedule. This could change each day, so you want to be flexible with it. For me, I know I'm not a morning workout person, so that'd be my last resort. But lunch might be a little bit more flexibility to do that, or evening times depending on the commitments with that. So take a look at your schedule, kind of break it down into 1, 2, 3, kind of easy, medium. Nope, that's not going to happen. So take 10 minutes of activity break at work. So take advantage of those little windows that you can do some activity in. Participate in a 30-minute class. So if you do belong to a facility, look maybe for some classes that are in that 30-minute time window. A lot of times if it's a shorter time, the intensity is going to be up a little bit, so you want to keep that in mind. Put exercise on your schedule. So put it on your schedule. It's going to pop up a reminder if you use your phone or your Outlook or your calendar. A few months back, we did talk about finding the right tool to organize your day. So put it on your schedule. Keeping it going. So use any available window of time to fit in exercise. So take a look at your schedule, see where you can put it in, put it on your schedule. Use household chores to get activity in. Change up your routine so you're not doing the same thing. So you want your routine to go along as your goals align with that too. So change that up. And you can always, if you do belong to a facility, don't hesitate to ask any of the trainers there, or contact your health coach within your insurance company too. So sometimes those wellness resources a lot of people don't know about. Be flexible. So just as your day changes too, try to be flexible with that also. So if you had maybe a 10-minute walk planned at 9 o'clock and you had a meeting scheduled, just try to shuffle that throughout your day. So to sum this up, you don't need to spend hours at the gym. Break down your workout sessions. 10 minutes of brisk walking in the morning, 10 minutes of exercise at your desk, and 10 minutes of interval training after work. So that's just an example of how you can break those 10-minute sessions up, but shooting for at least 150 minutes a week of moderate or 75 minutes of vigorous activity. So that's kind of the goal. And if weekends you have a little bit more time, try to maybe get longer bouts of exercise in at that time with that. Take the family to a park, so that way you don't feel like you're taking time away from the family. All right, well, we do have a little quiz. And there's our source. Question 1, the Center for Disease Control recommends at least 150 minutes of physical activity per week. True or false?
True.
All right, 1 for 1. Question 2, why is exercise important? Got multiple choice. It helps maintain or even prevent chronic health conditions. It's a stress reduction. It can help you sleep better, or all the above.
All the above.
All right. Okay. Question 3, you should do all 30 minutes of exercise at one time. True or false?
False.
All right. So just like we talked about, you can break that 30 minutes up into 2 15-minute or 3 10-minute sessions. Question 4, when it comes to intensity, how hard should you work out? Which of these is true? 1 minute of high intensity activity is the same as 2 minutes of low intensity activity. Moderate intensity means you can only say about 4 words at a time. High intensity means you can say a couple words at a time. Or D, all the above.
All the above.
All right, there was a lot of intensity in there. Perfect. Question 5, interval training involves alternating harder exercise with easier ones. True or false?
True.
All right. Question 6, it's okay to exercise the same muscle groups every day. True or false?
False.
All right. Question 7, you have to use weights when you do interval training. True or false?
False.
All right. Just like we talked about, you can do body weight exercises, so you don't always need to have some sort of equipment around. Okay. Question 8, what can you do to add activities to your workday? Do squats or lunges beside your desk, or pretend you're jumping rope. March up and down with a couple flights of stairs. walk quickly to and from lunch or around the building, all the above.
All the above.
All right, good. Really any movement, if you're moving, you're gonna burn calories. Question 9, doing 2 or 3 shorter workouts a day is just as effective as one long workout. True or false?
True.
All right, good job. All right, so that's a summary. Do we have any questions?
What do you think about fitness bands?
About what?
Fitness bands? Like the trackers?
Like the wearable devices? Personally, I like them. I have one. I think that they kind of help motivate, keep people accountable because you can track your food, you can track your exercise. Just like I talked about, you can see, for me, if I know I'm going to be in a car all day, I know my steps aren't going to be as much as if I'm in the office or at home. So I have to take into account my food consumption that day because I'm not moving as much. I'm, sedentary for a good part of the day. So it kind of helps me gauge as far as how many calories I have by tracking what I eat. But it's also fun to see, did I meet my step goal? So if you can set your step goal, the recommendation out there is 10,000 steps a day with it. And so you can try to reach that goal, kind of see where you're at each day. You can also kind of build a community with friends and have some fun that way with it. So it's up to the individual. There's a lot of devices out there, so you want to find the right one that's going to kind of meet your needs. It's going to be within your budget too, because they can get kind of spendy with that. But I like it. You can, just kind of helps me gauge and keeps things accountable for me. So. Yes.
If you don't have a wearable device, do you have a recommendation for a website or mobile app tracker that people can use for free?
Mobile app, I like my MyFitnessPal. That's got a nice exercise tracker. It's got a food tracker with it. It is free. As far as websites, you can go to our own website, averahealthplans.com. We've got the My365 online wellness portal that you can log into, track your exercise, get some tips and stuff, some virtual training there. The Center for Disease Control is another great resource. They've got kind of a little bit of everything as far as the guidelines that are set forth with that, and also the American Heart Association too. All right, well, I thank you for your time, and I look forward to seeing you guys next month.